This discussion is on your cleansing enema. So our focus is to explain the purpose and indication of your enema, identify the different types of enema, the equipment you'll be using, and the procedure for performing your cleansing enema. Then relate the different enema solutions to its actions and adverse effects. Now, let's start by answering the question, what is an enema? So when I talk about enema, students, it is the insertion of a liquid into the rectum or colon by the way of anus. Okay? Now, your best position for this one is Sims position with the right knee flexed. If I would look into this class, what do you think is the best position? Considering the structure of the colon. Diba? You will have your ascending colon, your transverse colon, descending colon, then part of your sigmoid colon going towards your anus and rectum. This is considered to be the left side of your body, and this one is the right side of your body. If I will be using or if I will be doing enema insertion, what do you think is the best position for my patient? Will it be left Sims position? Sa left ba siya nakatagilid? Or sa right siya nakatagilid? Ideas? So class, in this case, the patient should be positioned in the left side lying position or the left Sims position. What is the purpose of that? For the fluid to flow towards your rectum, towards your sigmoid, towards your colon. Come to think of it, if you will be positioning your patient to the right, fluid will enter this place and then what? Okay, when you will be turning to the right, yeah, it will return to your anus. It will just be returning to your anus. So nada, no effect. Okay, you're wasting your enema. So class, the Sims position would be right knee flex, but it will be left side lying position. Now, you need to monitor the patient's condition and you need to be very careful. Why? If your patient, dear students, is at risk for dehydration, if your patient has inflammatory bowel diseases, you are not supposed to inject or not supposed to administer, your enema. Again, contraindications would include your dehydration and then your inflammatory bowel disorders. Now, you need to visualize the surgical site and prevent trauma to the intestine or contamination. Okay? Now, class, this is the purpose of your enema. So again, it is used to visualize the surgical site and prevent trauma to the intestine or constipation or contamination. What do we mean by that? So class, we are doing your enema. You are doing your enema administration prior to the surgery. So class, your enema would be able to clean the bowel. In other words, nililinis niya yung intestines mo. For the purpose that the intestines during the operation would be clear. The intestines during the operation, class, will be clear of your fecal matter. So that's to prevent contamination. Imagine if there is fecal matter there and that will be going to other parts of your body. That would lead to contamination. So when do we usually do this? We are doing this evening before surgery or on the morning of surgery. Particularly, guys, this is the nice order of the doctor for the 12 midnight or the 10 p.m. prior to the surgery. Okay? That's why, class, its purpose is to clean the bowels. It is intended to clean the bowels. And commonly, what will be the order of the doctor? Perform enema until return flow is clear. What do we mean by return flow? Anytime, class, you'll be inserting the enema, if your patient is able, you would expect them to run to the comfort room. You would expect them to run to the lavatory because they would want their poop to be out. Okay, they would want their poop to be out. They will be triggered to poop. Okay, for that reason, class, the doctor would say, continue enema until return flow is clear. In other words, class, until the poop becomes clear, which would signal that your patient's bowel is already clean. That would signal that your patient's bowel is already clean. Now, what are the indications? As mentioned, you have your intestinal or abdominal pelvic surgery, because this would entail, class, surgery in the colon. This would entail movement in the colon, and if colon, class, is damaged, there might be contamination. Also, constipation. If you have had patients with chronic severe constipation, you would need to do your enema. Class, it is your enema that could help to expulse this solid stool mass. Next, you have your therapeutic enema. Class, for your therapeutic enema, it would be able to clean out the colon or the rectum. As the term implies, it's referred to as therapeutic. In other words, your patient has an underlying disease condition. And with that underlying disease condition, it needs to be addressed by a medication. That's why it's therapeutic enema. So it would be able to clean out the colon or the rectum, to relieve in constipation and threats class in diseases. Now class, for your enema, earlier I mentioned that your enema is contraindicated in inflammatory bowel disorders. Okay, contraindicated in inflammatory bowel disorders. Now, basta makita nyo, baka makita nyo doon sa right, nakasulat na there are notes that would tell you that enema is used in inflammatory bowel disorders. There are special types of enemas used for inflammatory bowel disorders. But these enemas are intended to reduce the diarrhea of your patient and to make a protective coating on the intestines. To clarify again, generally, it is not recommended among patients with inflammatory bowel diseases because it would aggravate the signs and symptoms of your patients. However, class, in the recent trends, there are specific enemas that are intended for that. Now, cleansing enema. Your cleansing enema class is a subtype of your therapeutic enemas. Now, you have here an example of fleet enema. I place this as an example to remind you that this is the common ones that we are using already in the clinical setting. Okay, gone are the days that we are using the soap sud enema, wherein you might be able to consume 1 liter, 2 liter, or 3 liters even of fluids placed on a pail class, a pail-like structure which would have a tube. Right now, we are using a fleet enema, commonly fleet enema. So class, your fleet enema would look like this. You remove the red nozzle here, and once you remove the red nozzle, insert that to the rectum of the patient and then squeeze. Once you insert it to the rectum of patient, once you squeeze it, class, your patient would feel defecation within 30 minutes to 1 hour. Okay, based on what I've observed. It would run 30 minutes to 1 hour. Okay, now, next you have your detoxification enema. Class, for detoxification enema, as the term implies, it is an enema that could eliminate toxins and increase the good bacteria. However, this is not common in medical practice. I, for once, have not seen this. Now, class, your barium enema is used to visualize, your lower GI tract. Example of that is your large intestine, your small intestine, small part of your small intestine. Now, class, when I say barium enema, there are actually two ways for us to administer your barium. We have your barium swallow, and then we have your barium enema. Barium swallow, if of course it's for the upper GI, it will be barium enema if it is for the lower GI. This is seen on X-ray class, and it would easily show us the structure of the colon. Remember that your colon is a soft organ, it's a soft tissue. In other words, dear students, you would not be able to easily visualize that in X-ray. Because in X-ray, you will only be seeing bones and the dense structures. So, to make the intestine visible in X-ray, barium enema is one of the ways. Okay, barium enema is one of the ways to make it visible in X-ray. Now, what do you think is your nursing intervention after administering barium enema? Because you've administered a chalk white substance to your patient. So the simple intervention is for you to drink, increase fluid intake, for you to drink plenty of water. That's to facilitate the excretion of your barium enema. You also educate your patients, class, that after the administration of your barium enema, there will be a tendency that the stool will become chalk white. Because others would be alarmed. Oops, what happened to my stool? Why is it white? Am I already dying? So they're not dying, class, but instead, class, it's the barium enema that's going out of their stools. Prior to the test, we also advise your patient, or no, we not advise, but we recommend, class, to have your creatinine taken. Okay, we need to have your creatinine taken. What's the purpose of your creatinine? To evaluate the functioning of your kidneys in such a way to ensure that the metabolites of your barium enema would be able to go out of the body. Now, let's go to your equipment. So what are the things that you need to prepare prior to enema administration? By the way, class, for your barium enema is usually administered already in the radiology department. Okay, that is in your X-ray department or CT scan department. If you will be administering that in the patient's room, if your protocol would mandate it, you need to rush the patient to the X-ray. because anytime soon, class, the enema will be going out and the x-ray image will not be as accurate as you would want it to be. Okay? Now, you have your disposable linen saver pad, then you have your bath blanket, then you have your bedpan or commode, then you will have your clean gloves. Then you will have your water-soluble lubricant if tubing is not pre-lubricated, and then you will have your paper towel. Okay, so these are the things that you need to prepare. Now, for your large volume enema students, you would need a solution container with tubing of correct size and tubing clamp. Then you need to have the correct solution, the amount, and temperature. Class, for your enema, you don't want it to be very cold. If it's very cold or cold, dear students, it would cause cramping. It would be very painful on the part of the patient. So the best answer, if you will be asked what's the temperature, it should be in room temperature. It should be in room temperature. Now, for the small volume enema, you could have the pre-packaged container of enema solution with a lubricated tip. It's just like the fleet enema that I have shown you in the previous slide. Now, you have the following commonly used enema solutions. So you would have your tap water, which is the amount is 500 to 1,000, plus the time for it to take effect is 15 minutes. And the adverse effect, if you would look at this, is fluid and electrolyte imbalance. Normal saline could also be administered. It could also have the same function within 15 minutes. Fluid and electrolyte imbalance is still common. Because come to look at it, you're administering saline, okay, in the patient's intestinal tract. When I say saline, that would contain sodium. Now, soap solution. For your soap solution students, you could administer it at 500 to 1,000 ml. The concentrate class is at 3 to 5 ml per 1,000 ml. What do you mean by that? There is a 3 to 5 ml of soap in every 1,000. Okay, in our practice in the past, we would usually use half of the soap bar, okay, in 1 to 2 liters class of fluids, depending on the order of the doctor. So class, it would irritate the intestinal mucosa, and after that irritation class, it could take effect in 10 to 15 minutes, but then one of the adverse effect is rectal mucosa irritation and damage. Imagine class, you're having soap in your intestine. So, the tendency class is for the patient to have your rectal mucosa irritation or damage. Okay? In a while. Now, for the next types of your enema, you would have your hypertonic solution. Remember, class, that when I say hypertonic solution, it is more concentrated. Okay, it's considered to be more concentrated. But look at the amount. It's only 70 to 130 ml. Okay, it is able to distend the intestines, and then class, it is irritating the intestinal mucosa. Then class, the time to effect is 5 to 10 ml. Then class, you will have your oil solution. So class, you have your mineral oil, olive oil, or cottonseed oil. Okay, so 150 to 200 ml. Okay, now it would be able to lubricate the stool and intestinal mucosa. Okay, that will be able to lubricate your stool and intestinal mucosa. Class, we commonly use the mineral oil as an agent to help a pediatric patient defecate if the child would have constipation. Okay, if the child would have constipation. Your hypertonic solution, actually, one example of that is your fleet enema. If you can notice, the amount is minimal, but then the effect would be the same. Okay, the effect would be the same for that matter. Now, if you will be doing the procedure, what do you do? So you introduce yourself and verify the client's identity, then explain to the client what we're going to do, why is it necessary, and how the client can cooperate. You need already to inform the client that one of the effect of the enema is that they might rush to the lavatory and that they would have the urge to defecate, or else they will become frustrated that that's happening to them. Okay, so you need to make them anticipate that. Now, you need to perform hand hygiene and observe appropriate infection control procedures. Then you provide privacy. Then, you assist your patient on left lateral position. The flexing of the right leg would make it the Sims position. Okay, remember class, in your Sims position, one leg is flexed. Okay, and the linen saver pad under the buttocks. So again, the purpose of that is that if there will be fecal leakage, that would not be damaging or that would not be contaminating class your linens. Then lubricate about 5 centimeters or 2 inches of the rectal tube. Then try to run some solution through the connecting tube of a large volume enema set and the rectal tube to expel any air in the tubing. Plus, there will be instances kasi that you're using your rectal tube. Now, you need to be careful that the rectal tube would not be containing air. So what do? Is that we prime the tube. When I say priming the tube, it means that the fluid would first flow to the tube in such before you insert it to your patient. Before you would be inserting the tube to your patient, the tube should already be primed or should already be filled with the fluid. Then after that, okay, so you would be, then you need to close the clamp. Okay, you need to close the clamp. Now, let's see. Then you insert the enema tube. During the insertion of your enema tube, the client should be in the lateral position, so you lift the upper buttock. Then insert the tube smoothly and slowly into the rectum, directing it towards the umbilicus. Class, when I say directing towards the umbilicus, meaning on the direction of your navel, on the direction of your umbilicus. Now, insert the tube 7 to 10 centimeters or 3 to 4 inches. If resistance will be encountered, students, at the internal sphincter, ask the client to take a deep breath. Because remember, class, you have your sphincters there. So, if there is some resistance during the insertion, meaning class the sphincter is not relaxed. Okay, your sphincter is not relaxed. So you need to ask the patient to take a deep breath. The deep breathing, dear students, would be able to help to open the sphincter. Again, the deep breathing could help to open and relax the sphincter. Then run a small amount of the solution through the tube. Remember, you have your clamp, which you can open to run the fluid. Then you never force a tube or solution entry. If you are instilling a small amount of solution, if does not permit the tube to be advanced or the solution to flow freely, you need to withdraw the tube. For example, diba, earlier we said that the patient would have deep breathing to relax the sphincter. If that didn't work, do not push. Because you might be touching some tumors, you might be touching some masses that could affect the patient. So do not push. That's the same principle in your catheter insertion. So you check for any stool. There might be some stool that might be blocking the tube during the insertion. Okay, so if present, you need to flush it and retry the procedure. You may also perform your DRE. So when I say DRE, that means digital rectal examination. Class, your digital rectal examination will be able to determine if there is impaction or other mechanical blockage. Now, if resistance would persist, you need to end the procedure. Okay, and you need to report the resistance to your doctor and the nurse in charge, or that may be your staff nurse if you are a student nurse. If you are already a staff nurse, you will be reporting to your head nurse. Okay, because class, the resistance would entail the need for your doctor to insert it. Sometimes in our case, we would usually request for a surgeon to insert it. Now, slowly administer the enema solution. If you are using class, the container, the solution container, you need to raise the container. Okay? Class, the container should be, there's a specific height on the next bullet. We'll talk about that. And open the clamp to allow the fluid to flow or compress a pliable container by hand. When I say pliable container, that's a container that you can squeeze. Okay, that you can squeeze. Now, for low enemas, you need to hold or hang the solution container not more than 12 inches. Take note of that, 12 inches. Now, remember your principle, the higher the container class, the faster the flow rate. Again, the higher the container, the faster the flow rate. How could it be? Because remember class, it's the gravity working. It's the gravity working. In a high enema, you need to hang the solution container approximately 45 centimeters or 18 inches above the rectum. That would be a little bit faster. Now, you need to administer the fluid slowly. If the client class would complain of fullness, if the client would complain of pain, you need to lower the tube or use the clamp to stop the flow. Because if your patient class is complaining of cramping if your patient is complaining of severe sudden onset abdominal pain, you might be doing your enema too fast. Again, cramping or sudden onset of abdominal pain, you are doing your enema too fast. And you don't want that to happen to your patient. So try to pause it, close it for 30 seconds, and then restart it. If it still persists, you need to inform the doctor. Now, if you are using a plastic or commercial container, roll it up as the fluid is instilled. After all the solution has been instilled, or when the client class cannot hold anymore and feels the desire to defecate, close the clamp and remove the rectal tube from the anus. Look at this, after all has been instilled, you can stop. Or when the patient tells you, Miss Nurse, I could not do this anymore, I would really want to run to the CR, you stop. If you will not stop, class, the patient would really defecate in front of you. And worst, class, it may be an explosive type of defecation that may be able to reach you. So place the rectal tube in a disposable towel as you withdraw it. And then, encourage the client to retain the enema. Okay, until, class, you will have the effect. So ask the client to remain lying down if they still don't have the urge. Then request the client to retain the solution for the appropriate amount of time. That would be 5 to 10 minutes for a cleansing enema and at least 30 minutes for a retention enema. Then assist the client to defecate, especially because if you're dealing with an old adult patient which should have problems in ambulation, you would need to assist them to defecate. Assist the client to a sitting position, bedpan or commode or toilet. And ask the client who is using the toilet not to flush it. Why? As mentioned earlier, until return flow is clear. If you have noticed that there are a lot of fecal matter present there, class, you would need to inform the doctor because there may be a need for another enema. Now, if the specimen of the feces is required, ask the client to use the bedpan or the commode. And then you also ask the physician if she would be alright with her to use the specimen with the enema. Then, class, you would be documenting your procedure with the following details. Type, volume, if appropriate enema was given, then the type of solution, the length of time retained, the amount, color, and consistency of the returns, and the relief of flatus and abdominal distension in the client record. Okay, that will be all for your discussion on your enemas.